And Pet Pals TV with all the pets, and Tom Dock, Director of Communications for Noah's Animal Hospitals. Stewie's here, but we're going to talk about Mabel today. Mabel has Cushing's disease. What is it?
Well, Cushing's disease, the actual name is hyperadrenocorticism. Okay, so it's easier to say Cushing's. It was actually found by an American neurosurgeon, Harvey Cushing.
In 1932.
In 1932.
I read up on that, yes.
You did,
yes,
absolutely.
Okay.
And so dogs, cats, people, all sorts of animals can get this disease.
Wow.
Let me turn the question around.
What?
Why did you take Mabel in? What was she doing?
Panting, urination, sometimes, and she never had an accident in the house before. And sometimes the plop, plop, fizz, fizz in the house too. Tummy got go big. Yep. Look at that. I noticed she just looked, you know, unsettled.
Okay.
And she doesn't want to go up and down the stairs anymore, but then again, she's old. She might be 15, 16 years old.
Right. And some people would say, well, that's normal aging changes, right? Well, let's say this, old age is not a disease, okay? And so we want to explore those things. And
say that again.
Old age is not a disease, okay? We want to explore what's causing these clinical signs. And you went to your veterinarian, Dr. Roach.
Right, right.
And she said, let's do blood work, right? Now, blood work, this is part of a diagnostic tree. We're going down a pathway. We've got to find out the examination that she did, along with the clinical signs that you're seeing, along with the blood work in your analysis, points us in a certain direction, okay? And when we got her blood work back, we noticed there were some elevated liver enzymes, which is pretty normal in this condition, but it takes us down a pathway where Dr. Roach then said, let's do an ultrasound and let's do more blood work. And that's what gave us the diagnosis of Cushing's, which basically means her adrenal gland, which sits at the point of her kidney, is producing too much cortisol, which is a stress hormone. So it's basically helps us control stress, helps us with our metabolism, helps us with our immune response. She's taking too much of it. The bottom line is she's taking steroids on the inside. Okay. And too many of them.
And she's gotten better. They did the blood work again, and she was better, and we go in for another test. How often will she have to go in for tests? Or
well, we've got to see what the medicine does. So the medicine stops the adrenal glands from producing so much cortisol, and once we get to a good steady state, a good therapeutic dose, we'll know how often we have to do blood work. Initially, the first year, we're probably going to do it every couple months, and then after that, if she gets to a steady state where she's in a good normal range, maybe every 6 months to a year.
I just don't want her to be in any pain. I don't think she's in any pain. She's just like stressed.
She's stressed, exactly.
She's stressed. So
she's just got too many of those steroids. Think about all the stories we hear about ball players with steroids, you know, and that kind of stuff. That's what she's feeling right now.
And but she still loves to eat and drink, let me tell you.
Well, that'll hopefully go away as her steroids come down. Yeah.
Well, okay, I can see that she's a little stressed right now too. Tom Dock, thank you for all that you do. Cushing's disease, you can look up some of the ailments, and also I invite you to, you know, take advantage of Noah's as well, or your vet, and do the best you can. But she's given me a lot. I want to give her the best life that I can.
Right, and we can talk about Cushing's online with email at petpalstv.com.
And also go to our website. He'll have more up there. Thank you, Tom.
My pleasure.
You got your hands full there.
Hi, baby.
We'll be back with more on Pet Pals TV. Yes.